What that means is those folks do not have to worry about a coverage gap. They get either a free Medicare drug plan or a lower priced Medicare drug plan. They pay a lower copay than you pay for your medications, and they have no coverage gap. Those folks don't have to worry about the donut hole. They don't worry about ever paying full price for drugs or 50% of drugs. Those percentages that I'm telling you about of people that are on Medicare Part D are currently receiving full or partial subsidy for their drug plan and have no coverage gap. Reason I'm telling you that, we'll be zooming in on another piece of paper, but there are today about 45 million Americans who are receiving Medicare that are eligible for Medicare Part D. They're all Medicare beneficiaries. However, because some folks retire from the federal government and don't have to buy a Medicare Part D, some are retired Medicare, military, Air Force, Army, Navy, Marines, and their spouse, they do not have to buy a Medicare Part D plan. And there's some folks that just say they're not going to buy a Medicare Part D plan. But currently in America, we have 26,650,000 Americans signed up for Medicare Part D. Again, that's 26.65 million Americans have signed up for Medicare Part D. Of those folks, the numbers in each of the states, the percentages I just told you, currently receiving low-income subsidy or Medicare Part D help do not have to worry about a coverage gap or a donut hole. Those are the folks in America who earn the least amount of money. Those folks in America who earn the least amount of money on what the government calls the federal poverty level, 150% of the federal poverty level has been established as the number to meet to receive low-income subsidy. If your income is 150% or less of the Medicare, of the federal poverty level, and I'm reading the 2009 figure of the federal poverty level at 150% is for a single person, $16,245. For a married couple, $21,855. If your income is at or below that level, you are eligible for the government's low-income subsidy. Now, they do have a second test, and that test has to do with any valuables that you own, stocks, bonds, mutual funds, money in the bank, or real estate other than the home you live in. They don't count if you're wearing a diamond ring on your finger or how much your home is worth. But if you have real estate outside of your home, if you have investment property, or if you have stocks, bonds, and mutual funds, those things may disqualify you from the low-income subsidy. However, if it's just your home, your car, and a few things that you own, they don't ask how much your stuff is worth. But if you have about $12,000 in investments as a single person or $24,000 as a married couple, that may disqualify you from the low-income subsidy. I apologize. I hope you fast-forwarded through part of this as I'm going through these figures if they didn't apply to you. However, the low-income subsidy is a very important part of Medicare and the Medicare prescription drug program. It's important because people receiving low-income subsidy are receiving help from the government, they're receiving the medications that they require to function in life, and they receive them at a level that they can afford. So the people in America today who need the most help are receiving the most help through the government program called low-income subsidy. A lot of folks aren't aware that there are other programs out there other than the government's low-income subsidy. And at some point, if you'd like, I can explain in full detail exactly how low-income subsidy works, but I've already told you about the levels for receiving low-income subsidy. Just keep in mind, low-income subsidy, if you apply for it and qualify, you will receive medications at a lower cost, you will pay less for your Medicare drug plan, and you might even receive it for free, and you do not have to worry about a coverage gap or a donut hole, as some people call it, ever affecting you and your receiving of your medication. However, if your friend or neighbor, somebody across the street, a loved one, is earning 151% of the federal poverty level, or they're receiving 100% of the federal poverty level in income, but they managed to put away a $20,000 nest egg, and they're slowly eating at that, but only slowly. Those folks will not qualify for the government's low-income subsidy. However, they qualify for the pharmaceutical assistance program from the company that manufactures their medication. And I think that if they qualify for it, you and I should let them know what that program is, how to access it, and how to get their medications, typically for free. There are some medications they may pay as much as $50 for a 3-month supply, but many medications they will receive for free because the prescription drug company will help them once they hit the coverage gap or donut hole.